Spine surgeons implant $50,000 neurostimulators for chronic back pain. Now LUPS brings that technology home. Deep inside your spine, wrapped around each vertebra, is a tiny muscle called the multifidus. It's barely bigger than your pinky finger, but this little muscle is responsible for something massive, keeping each segment of your spine stable and aligned, especially when you move, bend, or lift. Think of it like the individual bolts that hold a bicycle frame together. If one bolt loosens, the whole bike starts to wobble and creak under pressure. That's your multifidus. But here's what nobody tells you. When you injure your back, even slightly, your brain flips a protective switch. It turns off the multifidus to prevent movement in that area. It's an automatic survival mechanism. The problem? Once that muscle shuts down, it doesn't just turn back on by itself. It loses strength. Fat replaces the muscle fibers, and your spine becomes inherently unstable. So what happens next? Your big surface muscles, the ones you can feel, start overcompensating. They clench up trying to do the job the multifidus is supposed to do. That's where the tightness comes from. That's where the stiffness comes from. That constant feeling like your back is locked up. And here's the cruel part. Stretching, massage, even most physical therapy exercises target those big compensating muscles. They might feel good temporarily, they might release some tension, but they're not reactivating the multifidus. They're not turning your spine's control system back on. That's why the pain always comes back. You've been treating the symptom while the root cause stays dormant. Now, physiotherapists have known about multifidus dysfunction for years. In clinical settings, they use something called electrical muscle stimulation to reactivate these deep stabilizer muscles. The problem was, traditional TENS units you can buy for home use don't penetrate deep enough. They work on surface muscles, but they can't reach the multifidus. That's where AEMS changes everything. AEMS stands for Advanced Electrical Muscle Stimulation. It's a specific type of stimulation that's designed to target deep stabilizer muscles, not just surface tissue. LUPS uses clinical-grade AEMS technology to send precise electrical pulses deep into your spine, directly activating the multifidus muscle fibers. It's like sending a wake-up call to a muscle that's been asleep for years. Here's what happens when you use LUPS. First, the AEMS pulses cause the multifidus to contract. Probably the first time it's contracted properly in years. When that deep stabilizer finally fires, two things happen immediately. One, those big, overworked surface muscles can finally relax. That's where you feel the instant tension release. Two, your spine suddenly has its support system back. That's where the sense of stability comes from. But it doesn't stop there. Each 25-minute session is essentially a retraining workout for your multifidus. You're not just temporarily activating it, you're rebuilding its strength and endurance. Over the 12-week protocol, you're progressively restoring the neuromuscular control that your spine lost months or even years ago. Week 1 to 2, you'll typically notice the pain reduction as those compensating muscles stop working overtime. Week 4 to 6, you'll feel increased stability. Movements that used to feel risky or cause that catch in your back start feeling normal again. Week 8 to 12, your spine regains the natural automatic stability it's supposed to have. You're not thinking about your back anymore. You're not bracing before you move. You're just living. This isn't experimental. This is based on the same multifidus activation principles that spine surgeons use with implanted neurostimulators, procedures that cost $50,000 and require surgery. LUPS brings that same science to a device you can use at home for 25 minutes a day. Over 10,000 people bought LUPS this month alone, not because it's another gadget that promises relief, but because it's the first at-home system that actually retrains the muscle responsible for spinal stability. Now, you might be wondering, is this safe if I have a herniated disc or a sciatica? AEMS actually helps. By reactivating the multifidus, you're reducing the load on the disc and decreasing the muscle guarding that often makes nerve pain worse. Is this going to be painful or uncomfortable? Most people describe it as a deep, pulsing sensation. You control the intensity. It should feel like your muscles are working, not painful. Will I have to keep using it forever? The 12-week protocol is designed to rebuild baseline strength. After that, most people use it 2 to 3 times a week for maintenance, or whenever they feel their back starting to tighten up. Look, if you spent years dealing with back pain, trying things that didn't work, spending money on treatments that only help temporarily, I get the skepticism. That's why LUPS comes with a 90-day money-back guarantee. Use it through the entire 12-week protocol. If your back doesn't feel more stable, if the pain doesn't improve, if you're not moving more freely, return it for a full refund. The only risk is staying exactly where you are now. Here's the reality. Every week you wait is another week your multifidus stays dormant. Another week, those compensating muscles stay overworked. Another week, your spine stays unstable. The good news? You can start retraining your stabilizers today. If you see the orange button below, that means LUPS is currently in stock. Tap to check today's availability.